And we have a lot of questions about delayed treatment because of COVID. And where people had decided that they were going to move forward with radiation or whatever treatment, and then everything's been delayed now and shut down. So how important is it, in your opinion, to go get another MRI to sort of check growth, or what symptoms should people be looking for before they start, really being concerned that they need to move forward and that kind of thing?
Sure. Yeah. So I hope you're all doing well with COVID and plug to wear a mask. It definitely helps. I would say, look, COVID threw a wrench in the works, especially for people who had progression. Something's moving on you, and it's going to make a difference. Or if you were right on the cusp of being able to use radiosurgery and your tumor is going to grow and you're not going to have access to that treatment anymore, I'd move a little faster.
Hmm.
The one nice thing about a vestibular schwannoma is most of them don't move that fast. So you don't really hurt yourself waiting a year or two unless your hearing is plummeting, right? So if your hearing is really starting to go, you kind of want to get in front of that if it's still salvageable. So I would say if things are changing on you during COVID, you probably want to talk to your team about, how do I stay on top of this? Right now in New Jersey, our numbers are good, right? They shut us down for a while, rightfully so, because of the masks and the gowns weren't available. But as soon
Right.
as we could reopen, we started treating again. We started treating those patients where we felt that they were kind of urgent. We didn't want it to grow another 2 to 4 millimeters because we were afraid their hearing might become unsalvageable, or it'd start to push on a structure that we wouldn't want it to push on. Um, the one nice thing about Gamma Knife is, at least at our facility, it's not in the main hospital. There's no COVID patients anywhere, and you don't need a breathing tube, none of that stuff. So as far as imaging is concerned, again, a lot of it has to do with what was your imaging pattern before. Was it stable, stable, stable? Then you probably don't need to go for an MRI. Was it growing, 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 or was your hearing going down? Then you probably need to get caught up in the safest way possible. But on average, it's not an emergency. You can kind of wait until you feel that it's really safe and your exposure risk is low, because that obviously can be much worse than
Okay.
a millimeter of growth.
Okay.